Hi, Dr. de Kock. It's a pleasure having you here today. Thank you for joining us, and of course, congratulations on winning a Positive Droplet Award. As you know, these awards are handed out to individuals and teams that extend the research and technology in their fields with the use of digital PCR. So again, congratulations and thank you for all of your hard work.
Thank you very much.
So how long ago did you start using digital PCR? How long did it take for you to go from the phase where you said, I want to do, molecular monitoring until you actually, until recently? And you actually had a whole bunch of assays laid out and everything. And I know there's a lot of dynamics behind the scenes, like for example, sample acquisition, patients, and so forth. There's a lot of moving parts, but from a technical standpoint, how long did it take you and how long have you been at it?
Yeah, we started to use it in 2017, and I think it took us 1 to 2 years to develop and implement those multiplex assays. So yeah, I'm not sure is it fast, but I think it's okay.
No, that's good actually, because there's a lot of validation involved, of course. So that's always the big challenge. Yeah. And now that you have these assays, the hard part is done. So circulating cell-free DNA has really increased or become very popular as a monitoring tool. But I'm sure you've encountered both positive and negative sides of using circulating cell-free DNA. What do you think these two sides of the coin are?
I think the most challenging part was to optimize and standardize the pre-analytical workflow, because your analysis is really affected by how you handle the sample due to contamination of genomic cell-free DNA, which can be caused by disruption of white blood cells. And the fact that we tested samples from different sites in the Netherlands, they need to be shipped. Yeah. And that also can really affect the amount of cell-free DNA you have in your sample.
Yes,
So yeah, that was basically the reason why we first did our research on how to optimize and standardize those pre-analytic workflow. But what I really like about the Droplet Digital PCR is that you can quantify the nucleic acids, which we also used as a validity criteria into our routine clinical practice, because you can calculate your cell-free DNA concentration or your wild type, which can be used to determine like a cell-free DNA concentration range in which your fractional abundance calculation is reliable.
Yes.
And also in a monitoring setting, it's really helpful to have an absolute quantification of your concentration and fractional abundance, including those confidence intervals, because then it's really straightforward to see if there is a significant concentration change over time.
Yeah, excellent. Big general question, but things are evolving very quickly in both diagnostics, but also treatments and disease monitoring. Where do you see lung cancer in 5 years? Because right now it is a serious problem in Europe and North America, but it's even greater in Asia and other parts of the world.
Yeah, what I really hope is that there will be national screening programs to detect it as early as possible. And I think that would be really helpful, because the chance of getting cured, the chance of getting cured improves when you detect it earlier. And I think the lung cancer therapies are really shifting towards personalized medicine, which could be target therapy, and then you really need those molecular analysis. And I think more and more targets will become available and more therapies. And I think lung cancer patient will getting older and older. I think we can, maybe not in 5 years, but eventually people can live with it.
Excellent.
You know what I mean?
Yes.
Yeah.
So it becomes more of a chronic as opposed to...
it becomes a chronic disease, yeah. Not in 5 years maybe, but at the long
we
end.
can hope. We can hope. Are there any members of your team that you would like to shout out?
Yeah, I would really like to thank Dr. Dijman. She was my supervisor, and Professor Scharnost. He was my promoter. And now, Esther Visser, she's following me up in our research. So she's continuing on it, really to investigate if it is, if we can really use this in a routine clinical practice. And our diagnostic and monitoring strategy of lung cancer patients, if it is feasible to apply it in the routine clinical practice. I would like to thank Bio-Rad for supporting our research, which really helped us to improve lung cancer diagnostics and making innovative targeted therapies available for those patients in need.
Thank you, Dr. de Kock, for your contributions, not just to digital PCR, but of course to the advancements of monitoring, and hopefully this helps patients down the road. So thank you.
Yeah, thank you.